I think we have to differentiate between A, HER2 overexpression, so expression levels, and B, really genetic alterations that we are able to target. When we think about HER2 overexpression, a lot of research is ongoing. We have all kinds of trials also presented here at ESMO at late-breaking abstract number 2, I think, the MOUNTAINEER trial, combining Trastuzumab and Tucatinib, another treatment options for those patients. We have seen the data of the DESTINY studies, basically using Trastuzumab deruxtecan as a option for those HER2 overexpressed tumors. Furthermore, we are going into rare genetic alterations. And when we talk about NTRK, for example, this is like 1 out of 3,000 or 5,000 patients that actually has an NTRK fusion that we can treat. The treatment is very targetable and very effective, but it's a very rare event. We have treatment options for the KRAS G12C mutant population, which accounts for around 3.5, maybe 4% of the total population. Here also trials are ongoing targeting specifically KRAS G12C with adagrasib or sotorasib, always in combination with an anti-EGFR antibody. So the big question, of course, is when should we do this genetic testing for those very rare alterations? So what is important, what we have learned since this year's ASCO, where the paradigm study was presented at late-breaking abstract number 1, really showing that for left-sided RAS wild-type tumors, it is important for overall survival to really start with anti-EGFR treatment. So we need the RAS mutation analysis before we start treatment. Next to RAS, usually BRAF is tested, and of course microsatellite instability is tested. So this would be the first set before you want to start treatment in metastatic colorectal cancer. After the first 2 standard of treatment lines, I think here we should rebiopsy the patient, should go into a deep sequencing with an NGS-based sequencing, really look into those rare alterations as NTRK, as others, to really try to target those FGFR2 fusions, for example, and of course as the tumors evolve during treatment. It is also important with this new biopsy, after you have done some treatment, to get the HER2 overexpression, to see expression levels not only of HER2 but probably also of c-MET, because there we also have inhibitors. So there's a lot of research ongoing, mostly focusing on the MAP kinase pathway, but also looking into rare fusions such as NTRK that may be targeted.